Hey mama, as a pelvic floor physical therapist, I'm always looking out for your pelvic floor, and today's video is no exception. Many of my prenatal patients often ask me, what should I make sure to pack in my hospital bag? So today's video is all about what to pack with your pelvic floor in mind, and I've divided these items into 3 helpful categories. The first being labor and delivery support, the second being toileting tools, and the third being early recovery essentials. I will link all of the items listed in this video down in the description below for easy finding. Let's dive in. Feeling as calm and comfortable as possible during your labor and delivery plays an important role in your pelvic floor's ability to maintain its flexibility throughout your birthing experience. With that in mind, these are my recommendations for your labor and delivery tools. Having access to a birthing ball and/or a peanut ball is an especially helpful tool during your laboring process. This helps to keep the pelvis open and to promote lengthening of your pelvic floor as you're progressing. Many hospitals have these on hand for patients, but not all of them do. So make sure that you ask your birthing provider what they have on hand so you can plan accordingly. If they don't have them, I highly recommend bringing one with you. You can have them deflated, so easy transport is available with that, and make sure that you pack a pump with it so you can pump it up at the hospital when you get there. Be sure to pack a pair of waterproof sandals. These are helpful for when you're moving about your room as well as on the hospital floor. Different bodily fluids are going to be happening during this process, and if your water breaks during this journey, you'll be able to have an easy cleanup. A Squatty Potty. This is one of my favorite tools to make sure to bring with you to the hospital. Not only is it helpful during your laboring process, and especially if you'd like to do so over the toilet, which many of my patients have found to be helpful for them, but this is also a really helpful tool in promoting lengthening of your pelvic floor and is also a really helpful item to have for your toileting toolbox postpartum. If you don't already have one of these at home, I highly recommend purchasing one that is foldable, so that helps with easy transport. Essential oils. Be sure to pack 1 or 2 of your favorite scents. These are really helpful when we are navigating waves of nausea, pain, and helping to recenter yourself when things become challenging. Peppermint is one of my personal favorites, and also it is super useful for that first trip to the bathroom postpartum. I'll explain why later on in this video. Electronic essentials. I recommend getting a long phone charger because you never quite know exactly where the outlet will be next to your hospital bed. I also recommend bringing a portable speaker, headphones, and a push playlist already queued up on your phone. Music is a really powerful tool that can help calm, encourage, and also help you stay focused throughout your birthing experience. Bringing an eye mask and earplugs are helpful to be able to block out unwanted light and noise along the way. I also recommend bringing your own pillow for comfort. If you do so, be sure to use a pillowcase that is a noticeable color so it doesn't get mixed up with the hospital ones. Bring a water bottle with a straw so that you can sip and stay hydrated throughout your laboring process. Constipation is real, and that also makes that first poop postpartum really uncomfortable. So be sure to stay as hydrated as possible. Lastly, be sure to pack some extra snacks for you and your birthing partner. Laboring can be a very long journey, and it's helpful to have some snacks on hand. Most people are terrified about how their first pee and poop experience is going to feel postpartum. I totally get it. That's why we're going to talk about it here. Preparing ahead of time with these tools will help you feel more empowered and less afraid of what's to come. Squatty Potty, making its second appearance on this list. This tool is really helpful for decreasing extra pressure down onto your pelvic floor and your perineum that are recovering from your labor and delivery process. When we are having our first bowel movement, it is really important that we promote lengthening through that pelvic floor and also to decrease extra straining downward on tissues that are healing. That is what the Squatty Potty does in putting our body into a deeper squat position that is supported to promote these things automatically. If we've had any pelvic floor tearing, hemorrhoids, or constipation, the Squatty Potty is going to be even more important for your postpartum recovery. Also, if you had any pain meds that assisted you during the process of your delivery, like an epidural or during your C-section delivery, pain meds slow down our GI system, which also increases the likelihood of constipation. So you want to make sure to have a Squatty Potty on hand in these cases. Peppermint Essential Oil. This oil is a game changer to have in your toileting toolbox. It is not uncommon for the first pee or poop to be difficult to initiate postpartum. A big reason for this is the increased swelling throughout the vaginal tissues and also the perineum, making it difficult to initiate that urine stream or to pass a bowel movement. Another reason for this is if you happen to have a catheter during your epidural or your C-section delivery, Removing that catheter can initially make it difficult for the pelvic floor muscles to remember how to coordinate for toileting tasks. The menthol in the Peppermint Essential Oil actually has a natural relaxation effect on our pelvic floor tissues. So in order to take advantage of this, simply take your oil and place a few drops into your toilet bowl. Take a seat over the toilet with your feet propped up on your Squatty Potty for support. Take some deep breaths and let the magic happen. A Peri Bottle to rinse after toileting. Ladies, we want to make sure not to use rough toilet paper to wipe ourselves after toileting early postpartum. Your vaginal tissues are sore and swollen and often have stitches. The best thing to use is a Peri Bottle with warm water and then to blot away any excess liquid that's remaining with a wet wipe. Another option to use are the Tuck's Witch Hazel wipes that are also really helpful if you are suffering from hemorrhoids or have any anorectal discomfort. Cooling spray for pain relief around your vulva, perineum, and anal region is your best friend early postpartum. Often in the hospital, many are provided with Dermaplast, which is a great option, and another one that many of my patients like is Earth Mama's Perineal Spray. Magnesium Citrate Gummies. These help to soften stool and aid with constipation. I recommend my patients begin these approximately a week before their due date and also to continue to use them early postpartum as needed to keep things moving. These are generally safe for most people postpartum, even if you're breastfeeding, but I highly recommend that you consult with your individual provider to make sure this is an appropriate recommendation for you. Mama, you deserve to feel as comfortable as possible after the delivery of your little one. With that in mind, I recommend being sure to pack the following items. First, your personal toiletry bag. I know this sounds like a no-duh kind of thing, but I can't tell you how many of my patients have shared with me that they forgot to pack this item for themselves. So I want to make sure to list it here so you don't forget it as well. Absorbent underwear for your postpartum bleeding. The hospital will provide you with disposable options to help you with this, and many people will take extra home for their postpartum recovery. It is common for people to bleed for approximately 2 weeks postpartum, so not everyone enjoys that disposable diaper-like feeling and prefers to invest in some non-disposable options as well. These are very much similar to period underwear, and they can feel a lot more comfortable for those early weeks postpartum. Some brands also have space for a specific pad that you can place inside of the underwear, as well as a space for a perineal ice pack. Many of my patients have found these to be helpful in their postpartum recovery. Supportive compression garments. A postpartum belly wrap or high-waisted underwear that has some gentle compression are really helpful tools to provide support to your abdominal wall, as well as to help with swelling management. Regardless of your delivery method, your abdominal wall and pelvic floor muscles went through a lot, and they're not going to be able to provide the support that you're used to right away. These gentle supportive compression garments can be a really helpful tool to provide temporary support around your abdominal wall and also to offload your pelvic floor, making it easier and fast-forwarding your recovery process, making it more streamlined. An important note with these compression garments, make sure that the amount of compression around your torso isn't too tight where it constricts your breathing, and also make sure that it's not too tight where it's creating downward pressure onto your pelvic floor. If it does, that's going to negatively impact your recovery process. You want it to feel like a supportive hug without constricting in the process. Friendly reminder to bring comfortable clothing like loose sweatpants instead of your tight leggings, a robe, preferably one with pockets, and slippers so that you can be as comfortable as possible during your hospital stay. Lastly, if you plan on nursing, be sure to bring the following: your nursing bras, nursing pillow, your breast pump, your nipple cream, and also silver nursing cups. My patients swear by these. It's helpful to bring all of these items with you so that you can discuss with the lactation consultant at the hospital before heading home. I hope you found today's video helpful in streamlining your packing process. Let me know in the comments below what you'll be bringing with you from this list and anything else I should add. In staying on point with today's theme of labor and delivery, our next video is going to be all about pushing and how to do it more effectively to reduce pelvic floor tearing. I look forward to seeing you there.